Almost everyone carries the crushing weight of some physical or mental illness. When hardship strikes, our immediate instinct is to find a way out, to seek relief from the pain by any means necessary. But we rarely stop to understand where that suffering is actually coming from. You cannot separate an illness from your life until you isolate its true root cause. When we try to trace those hidden causes today, society forces us into a difficult choice. We are pulled between two completely opposite ways of looking at the world. On one side is a purely materialistic view. Modern science has achieved incredible things, leading some to dismiss the spiritual realm entirely. They view every ailment, every anxiety, and every behavior as a strict biological equation with a chemical solution. On the other side is extreme superstition. This text outlines how myths, fables, and a lack of verified knowledge cause people to blame every headache, failed exam, or marital argument on the jinn or witchcraft. This leaves the average person caught in the middle. The confusion deepens because clinical mental illnesses can perfectly mimic the exact symptoms of a spiritual affliction. The medical profession is a vital part of the healing process. Those who dedicate their lives to diagnosing illness and bringing relief to patients deserve deep honor. Finding physical cures is part of the design established by the Creator. This page details the biological origins of psychological distress. Endocrine imbalances in the pituitary, thyroid, and adrenal glands cause severe behavior disorders. Life pressures also overwhelm the nervous system. Therefore, never neglect medical care. Biological illnesses require biological interventions. But while medicine is our first line of defense in the physical world, doctors eventually face hard limits. Science struggles when it is asked to treat an affliction it cannot measure or see. This excerpt highlights the concept of al-ghaib, the unseen world. Belief in the existence of the jinn is a foundational Islamic truth, affirmed by both the Quran and the Sunnah, not a remnant of primitive fairy tales. While their power over human beings is strictly limited, jinn can interfere in our lives. When they do, the harm they cause is often physical and tangible. This interference can manifest as the sudden paralysis of a limb, severe tightness in the chest, or persistent migraines that defy all medical logic and fail to respond to standard painkillers. The harm extends into the mind. This list categorizes the sicknesses caused by jinn, pointing directly to severe psychological and nervous disorders. Afflictions can include intense fear, relentless whispers, known as waswasa, depression, and even madness. When medical science fails to find a root cause, spiritual practitioners step in. They use a systematic set of screening questions to separate a biological illness from a spiritual one. They look for specific anomalies. Does the patient experience intense pain, numbness, or sudden unnatural drowsiness, specifically when listening to the Quran? Are there unexplained nightmares, an urge to cry without reason, or severe female health irregularities? A true diagnosis requires looking at the full picture. You have to evaluate the physical symptoms alongside how the patient reacts spiritually. There comes a tipping point. Often, a patient undergoes countless medical examinations, yet the tests show absolutely no underlying biological cause. Despite aggressive treatment, their condition remains the same, or even worsens. In these specific scenarios, physicians shouldn't feel compelled to continue prescribing heavier medications indefinitely. This is exactly where spiritual treatment deserves a place alongside medical care. The spiritual prescription is clear. Healing is sought through ruqyah, treatment via the recitation of the Quran and the Sunnah, addressing the unseen affliction directly. This passage proposes a powerful middle path. It suggests psychiatric hospitals open dedicated departments for Qur'anic treatment alongside medical doctors. This creates a fail-safe. If recitation helps, Allah is praised. If not, there are no side effects and conventional treatment resumes. We also have to abandon a dangerous misconception. Being afflicted by jinn or witchcraft is not a sign of weak faith. Even the most sincere worshippers and devoted believers face these hidden trials. True healing requires balance. A balanced believer respects the hard facts of medical science, fiercely rejects fraudulent healers and superstitious charms, and ultimately places their complete trust in the Creator to navigate the complexities of both the seen and unseen worlds.